Hi friends, this video is for the medical and the paramedical staffs who are getting continuously exposed to the coronavirus because of being into active healthcare management. As the number of the casualties of doctors and the paramedical staffs is increasing day by day all over the world, and if we talk specifically about India, with around 300 doctors officially dead from the coronavirus infection, an innumerable number of nurses, paramedical staffs, the exact figure is not clear, and especially those who are on the contractual basis, so the figures are not clear. So it's time to think about our own health because we also have a family to run. And with those who are in government job, maybe they get some benefits. Otherwise, those into private practice, those into the contractual jobs, actually nobody is going to take care of your family once you are gone. So it is time to take care of yourself too. So what can we do to minimize these circumstances, to minimize getting infected? Friends, recently my paper got accepted for publication into one of the PubMed index journals, and my recommendations are: one, that the most important thing is, as we know that once we are exposed to the virus, we develop antibodies. But as we know, the reports are there that antibodies are going to disappear soon. Some reports say 2 months, some reports say 3 months, some say 4 months. And with recent one case of reinfection already there, and with the Hong Kong reporting the first case of reinfection, so obviously we are getting more worried as to how much these antibodies can save us. There was one study which was published in Nature last month, and it shows that just like coronavirus, the SARS virus, which was there 17 years back, so there also after infection, after some times the antibodies used to disappear, just like coronaviruses. And after two years, practically there were no antibodies in the blood. So what the scientists did, they exposed those recovered patients after 17 years. So after 17 years, when there are no antibodies, they exposed their blood to the SARS coronavirus. What they found was the antibodies re-emerged. So there was a role of memory T cells, memory B cells, which we are actually ignoring only if we only concentrate on the antibodies. So it's not only antibodies, but there is another thing that is known as the memory cells. So with this study shows that even if there are no antibodies, you may be actually safe. And with the recent first confirmed reinfection case, which has been reported from Hong Kong, as the patient who was first infected 4 months back, he has a reinfection. But the good thing was he was totally asymptomatic. So it means the antibodies in his body actually took care of the infection, and the patient did not land up into serious infection. So still, what we may consider is that for 3 to 4 months we are actually safe. After 4 months, okay, we can again consider us to be safe, but not 100%, because antibodies are going to disappear. So what I recommend for all those practicing doctors or the nurses or the staffs are to just get a simple blood test. This blood test is just a 1-minute test, and you will get the report by evening time. Many of the labs are doing this test, and this test is ELISA test for antibodies, IgG and IgM. Once your IgG is positive, it means that you are practically safe from the coronavirus. So what I recommend to you is get this cheap test done. And if you are positive, you consider yourself safe. And repeat this test after 3 or 4 months again. If your antibodies have become nil or negative, then you may take all those precautions. If you are positive, you may, even without any safety gear, you can actually feel safe. And if it is negative, then again you should take care. And those who are negative means they are those who are unexposed to the virus. They need to take full care of protection. And specifically those doctors who are obese, who are hypertensive, and with other risk factors, they should either avoid getting in front with the patients or should take back gear. They should use all sorts of precaution before coming into contact with these patients. So this is my recommendation for you, friends. Thank you very much.